Hey everyone, I was just talking to some of my registrars yesterday about what makes a great clinic that you work at as a training doctor. Generally, registrars will come into a training place 2 years after they've been a doctor. So first year is intern at the hospital, second year usually hospital year as well. Sometimes a third year or fourth year, but generally at least 2 years, and they'll come work as a registrar. You'll find that registrars come from a variety of different places: surgical, medical, some completely even out of medicine, some from overseas. And how can you accommodate them? So I think, just referring back to one of my other videos on recruitment or retention, having a registrar stream is a really important way of keeping doctors around, especially in rural areas. So we're a training practice. We have a lot of registrars. They seem to really enjoy it here. One of the old caveats is doctors recruit doctors, and certainly registrars recruit registrars. If they're having a good time, they're really well supported, then they'll recommend their friends come to your place, to your clinic, not to your place. And hopefully they will also have a great learning environment, stick around and talk to their friends as well. So it sort of profligates from there. One of the things that I've found in terms of what makes a good clinic, based on my own experience as a registrar, but also from what I can see in my own clinic, there's probably about five key things I think that are really important. So one is obviously really good clinical support. I'd probably say that's number one. If you can offer really good clinical support, despite having old computers or not great parking or something like that, people will definitely like that if they have that great clinical support. I think as a registrar, and certainly I can say this of myself when I was a registrar, having the clinical support was really key in starting in general practice, which is kind of a scary specialty. It's one of the only specialties where you sort of sit by yourself before you're fellowed. With a lot of other specialties, you'll be on your own with the patient after you've fellowed, in the case of surgery or physicians, things like that. So it can be a bit scary sitting on your own, having a patient come in with something that you have no idea about, you don't know what they're coming in with. So I think it can be scary in that way. So having really great clinical support is really important. I think the other thing that's really important, or the other two things that I'd say, so operational support, so that's just support with things like computer systems, AI if your clinic's using it, operation support in the context of your care plans, health assessments, nursing support. They're a real important key thing as well. In terms of the teaching side, clinical teaching of course, but I think it's also worthwhile teaching about finances. So how do you use the billing system, which is very peculiar? How do you set up yourself as a contractor? How do you get your own insurance? All these things which you don't really need to worry about when you're working in the hospital. So I find that's a key thing. And then I think the fifth thing, pretty sure I've gone through five, the fifth thing being that having a good social support system. Again, being in general practice can be really difficult. You might see 20 patients a day. You might do really, really well with a patient, but they might feel that they weren't listened to, or that the issue that they came in wasn't covered. And it might be that you did cover it, but there is a miscommunication between the patient and yourself. And that can be difficult. I think all doctors, especially registrars, we all try really hard with our patients. And sometimes you get that feedback that there just was, miscommunication between yourself and the patient. No one's, at fault, but it's just something that's occurred, and you can get really down on yourself. So having a good support system in a rural practice, we're a rural practice here at Condamine. We like to do social gatherings, talk about those things. I think they call it or refer to it as a Balint group. So just talk about how you handle certain situations and strategies and techniques and things like that. So I think they're the five key things for having a really good practice in terms of training placement as a registrar. So they're the things that we try and emulate at Condamine. Certainly, we love AI. That really makes a big difference in terms of your ability to see patients and really focus on them. As I think it's a real big help. And I know that I'm sort of ironically saying all of these things, and I just noticed on my phone, you can see that there, phone not working. Excellent. We're getting onto that. But otherwise, this room is pretty good. Dual screen monitors as the other. That's the sixth extra tip. Having two screens, which I don't, but having two screens is very helpful. But other than that, they're the top five things. So operational support, a bit of financial support, social support, and having a really great clinical and learning environment make it so much easier to go to a practice as a GP. That's what we try and do. And I think we do it pretty well because doctors are pretty smart. They'll vote with their feet. So if they come into your practice, you're probably doing something right. Hopefully that's been helpful. Thanks. Bye.